today let's start Anaesthesia INICET 2020 paper. First question. A patient with a blunt chest trauma has been started on a mechanical ventilation. Which of the following is not a correct about initial setting? Respiratory rate 12 breaths per minute. Okay. 12 breaths per minute is not too fast breathing. Yes, it's correct. Positive and expiratory pressure is 5 centimeter of water. Yes, that's also correct. FiO2 is 100%. Yes. Initially we will keep a high. After that we will slowly reduce it because if we keep 100% for a long time, there will be oxygen toxicity. Next, the tidal volume is 12 ml per kg of actual body weight. Actually, the tidal volume is kept in 4 to 5 ml per kg. Okay, not this is too high tidal volume. Okay, see, initial setting of the ventilator. What all things we should consider? This tidal volume 4 to 6 ml per kg of total body weight. Respiratory rate is 12 breaths per minute, that is fine. FiO2 is 100% to begin with, then titrate to the lesser value to prevent oxygen toxicity. Whereas PEEP is being with a 5 centimeter of water, titrated to the 10 centimeter of water, carefully increased, as high PEEP may impair the ventricular filling in a patient with blunt chest trauma. So we will not increase it suddenly, slowly we will increase. But FiO2 slowly we will decrease, whereas PEEP we will slowly increase to 10 centimeter of water. Okay, tidal volume and PEEP are almost same, but then PEEP is increased to 10, which is near to the respiratory rate. Okay, almost all the values are nearby. Okay, next, coming to the second question, this is the repeat question. Okay, glycopyrrolate is used as a pre-anesthetic agent for reducing the secretion. It is an anticholinergic drug, which is like a atropine, but here the advantage is it does not cross blood-brain barrier. Okay. Third one, the blue pipeline in the operation theatre is used for delivering which of the following gases? Blue is Neel. Okay, Neeli or Neel. Okay, in Hindi it's called Neel. So it is nitrous oxide. Okay, let's see different colors. See, these are the combinations of the color. First you have to remember oxygen. Oxygen, only the top of the shoulder is white, then full body is black. Whereas nitrous oxide, the full body is blue. Okay, whereas nitrogen is black. It is a gas. Nitrogen is a black. So next, coming to the air. Air is a combination of what? Oxygen and nitrogen. So we know that the more percentage of nitrogen is present. So we will combine this cylinder with this cylinder. So we will get what? Shoulder is half white and half black and body is full black. So this is the mixture of nitrogen and oxygen. Okay, you can remember like that. Whereas Antonox gas is a mixture of nitrous oxide and oxygen. Oxygen is, the shoulder is white, isn't it? Whereas nitrous oxide is Neel. Okay, so blue. So its shoulder is white or blue, body is blue. Okay. Till now what I have told is the cylinders. Okay, these are some of the pipelines you can see in the hospitals. White is the oxygen pipeline, whereas air will have a white and black. Nitrous oxide is blue pipeline, whereas yellow pipeline is for vacuum or a central suctioning. Okay, third question done. Fourth one, this question have repeated many times. Let's see in detail, okay? Which of the following can be considered as an effective CPR? First one, respiratory rate of 20 to 24 breaths per minute. Okay. Chest compression is 100 to 120 per minute. Allow complete chest recoil. Obviously, this is correct. Whereas 5 to centimeter, we have to depression. Okay. This is also correct. This 3 is obviously correct. So, option A and C are obviously correct. But respiratory rate is 20 to 24 is very high, isn't it? Okay, it's very high. So, we can rule out all the 1 options. Only C is correct. Okay, let's in detail see. Provide 100 to 120 compressions per minute. That means you have to give 30 compressions in every 15 to 18 seconds. That means it is double. 15 seconds you have to give 30 compressions, whereas in 1 minute you have to give at least 100 to 120 compressions per minute. You have to place your arm one over the other in the midline in the lower 1/3 of the patient's sternum and lock your arms. Okay. Use both arms to press the chest to the deep 5 to 6 centimeter. This was given in the option, isn't it? Sometimes they will give in inches. That means 2 to 2.4 inches or more. Press hard and fast. Allow full chest recoil. Yes. The respiratory rate, the ideal breaths for an adult is 10 breaths per minute. Okay. Per minute you can give 10 breaths. Whereas in children, there is 20 to 30 breaths per minute. But in this question, they have not mentioned it's a child or an adult. But if they have not mentioned specifically, that means they are talking about adults. So we can consider this. Okay. So the one, option one is wrong. Okay. Let's see others also. In child, C, same. Provide 100 to 120 compressions, correct. In infants also, that is correct. Okay. But you have to place one or both the palms are placed in the midline. Okay. The depth of compression is 2 inches. Okay. Here that was also 2 inches, that is 5 to 6 centimeter. Press hard and fast. Allow the full chest recoil. Here the only difference is this one or both the palms are placed in the midline. Okay. In infants, if there are one provider, that is one provider for a CPR, then you can place 2 fingers, one between the nipples and other is 1 centimeter below. If 2 providers are there, then you can encircle the infant torso with both the hands with both thumb pointing towards the cephalic position 1 centimeter below the nipple or the sternum. These pictures I have put in, I think, other papers, but I'll show you the pictures in other question papers. So the depth of compression is 1.5 inches. Okay, there it was 2 inches, right? 2 to 2.4 inches, but here it's just 1.5 inches or 1/3 of the depth of the infant's chest. Press hard and fast. Allow full chest recoil for every compression. Okay, here the wrong option is 1, hence all is ruled out, only C is correct.